So first of all, let's jump to the introduction of the lecture. When we talk about dental implant, we are talking about osseointegration. But long time ago, we used to say that osseointegrated implant is a successful implant, but not anymore. Osseointegration is not the only parameter that upon it we can judge the success of the implant. Even if you do a precise ceramic duplication of the contour, shade, translucency of natural dentition, still maybe you don't have the exact result that your patient is asking for. What the patient is asking for is a good restoration. Always remember, your patient didn't come to you just to have a nice osseointegrated implant. He won't smile with a nice osseointegrated implant, but your patient will smile with a good restoration. And to have a good restoration, you need to have a good, something called emergence profile. What is emergence profile? Emergence profile is the contour of a tooth or restoration while it emerges from the gingiva. And the contour of an implant abutment where it arises from the implant platform. So for emergence profile, it's important to have a good restoration and also to have a good soft tissue management, because emergence profile means a good restoration and a good soft tissue management. When we talk about soft tissue, of course, everyone who places implants knows to manipulate the soft tissue, you need a healing abutment to get a good emergence profile like this one. This is what I can call a good emergence profile, a good soft tissue management. So you need to do some manipulation using whatever healing abutment, using a lot of things. Before I start, I have to tell you something. There is something called